Hello everyone, this is Glenn Downing, Certified Financial Planner and Registered Investment Advisor at CameronDowning here in Miami, Florida. In this video, I want to take a good look at the various parts of Medicare and how they work together. Original Medicare is a creation of the Johnson administration back in 1965. Medicare is health insurance for those age 65 plus. There's a premium associated with coverage, and this premium is deducted from the Social Security benefit. As with any government program, there's nothing easy to understand about Medicare. The rules are vast and complex, but in this video I'll try to cover just the highlights. Please don't confuse Medicare with Medicaid. Medicare is health insurance. Medicaid is a state welfare benefit. The Medicare beneficiary is age 65 or is someone who has been receiving Social Security disability for more than 2 years. Coverage is for individuals only. Therefore, a retiree of age 65 cannot cover his spouse of 63 on the same policy. The spouse will have to wait 2 more years to elect coverage. Medicare has parts A, B, C, and D. First, we'll look at Part A. Basically, Medicare Part A covers hospitalization and Part B covers doctors. For Part A, the premium is on a sliding scale from $0 to $411 per month. For Part B, most pay $104.90 per month and $166 per year deductible. In 2016, Medicare Part A pays hospitalization benefits for 150 days. The copay for the first 60 days is $0. Medicare picks up the full tab. After that, there's a $12.88 deductible. Then for the next 30 days, there's a copay of $322 per day. And for the final 60 days, a copay of $644 per day. And after 150 days, there is no coverage. You're on your own. If you've been hospitalized for more than 3 days, then you're covered for post-hospital care in a skilled nursing facility for up to 100 days, as well as an unlimited number of post-hospital home health services. Medicare Part A covers hospice care as well. Now, Part B. When you hear Medicare Part B, think doctors and tests. Part B covers doctor's services, including surgeries, at the doctor's office or other institution, as hospital, assisted living facility, or a nursing home. Also covered are diagnostic tests, radiology and pathology, drugs that cannot be self-administered, and limited treatment for mental illness. Part B also covers outpatient services from a participating hospital for treatment of an injury or illness, and unlimited home health services, same as Part A. Preventive care services are also covered under Medicare Part B. These include mammograms and colorectal cancer screening, as well as an annual physical. Depression screening, counseling for alcohol misuse, and obesity are also covered. Medically necessary supplies, such as wheelchairs and walkers, are covered under Part B as well, as are ambulance services. After you've paid your annual deductible under Part B, you're responsible for 20% of approved charges. This is your out-of-pocket expense. What's excluded? Neither Part A nor Part B covers any dental expense, nor dentures, nor does it cover eye exams or hearing aids. Although 1 flu shot per year is covered, most other immunizations are excluded. Prescription drugs are also not covered under Parts A and B. You're also on your own for that tummy tuck or eye lift. Since there is Medicare Part A and B, and now the relatively new Part D for prescription drugs, which I'm coming to, what's Part C? Well, around 1/3 of Medicare beneficiaries choose to get their benefits from a Medicare Advantage plan. That is also known as a Medicare Private Health Plan, also known as Part C. Medicare Advantage plans contract with the federal government and are paid a fixed amount per person to provide benefits. These are typically HMOs, health maintenance organizations, PPOs, preferred provider organizations, and PFFs, private fee-for-service providers. You must have Medicare Parts A and B to enroll in a Medicare Advantage plan. There will be an additional premium for this coverage. The benefits provided under Part C must generally be equal to or superior to those of original Medicare, with the exception of hospice care, which is not provided here. Medicare Advantage plans may offer additional coverages, such as vision, hearing, and dental, and/or health and wellness programs. Most plans include Medicare Part D prescription drug coverage. Medicare Part D is a creature of the Bush administration, they're relatively new. It adds prescription drug coverage to original Medicare. You cannot have drug coverage under both Part D and Medicare Advantage. If at some point you add Medicare Part D and already have a Medicare Advantage plan, that plan will need to delete its prescription drug coverage for you. There is no coverage anywhere in the Medicare program for over-the-counter drugs. Now, I'm sure you've heard the term Medigap policy. What is this? Clearly, there are a lot of gaps in Medicare coverage. Any sort of hospital stay that lasts past 2 months could run up a tab of thousands of dollars. Medigap insurance can cover these out-of-pocket costs. A Medicare supplement insurance policy, known as Medigap, is designed to cover the deductibles and coinsurance amounts of Parts A and B. These policies are sold by private insurance companies. To be eligible, you must have Parts A and B of Medicare, but cannot have Part C or a medical savings account. They are mutually exclusive. Medigap policies are sold to individuals, so husband and wife need 2 policies. They are guaranteed renewable, meaning the insurance company cannot drop you due to your claims history. The coverage of Medigap policies varies by the plan chosen. They are plans A through N. There is not a way to get 100% coverage. The insured must choose the coverage that's most important in those various plans. Now, this video is clearly by no means exhaustive, just meant to give you a general overview of the Medicare program. Health insurance coverage for someone who's planning retirement is a serious issue and one which requires due diligence. The largest risk a retiree faces to financial stability is a long and debilitating illness. It's important to consider carefully the coverage to purchase and the out-of-pocket costs associated with that coverage. The rules for signing up for the various Medicare parts are complex, as is, of course, anything coming out of the federal government, and really beyond the scope of this video. So for more information, go to Medicare.gov. That is a great resource. I hope we've provided you some good information here. If you've got any questions, by all means, get in touch. Email to info@CameronDowning.com. Please connect with us on LinkedIn. Follow us on Twitter. Visit our website at www.CameronDowning.com, where you'll see all of our blog entries and book an appointment to come see us. Take care. We'll see you next time.